out, and that's also why they get hairballs. Nobody else gets hairballs because of the papillae on the tongue. And the frenulum is a little membrane that's underneath the tongue, the one that's underneath your tongue too, that attaches the tongue to the bottom of the roof of the mouth, right there. Right there. All right, so what we're going to do, there's the neck and the way it's been opened up. And what you can see is...
Like in this direction?
Yes. Yeah, we're going to cut from the tip of the chin straight down, and then you ignore that, and then you can go ahead and come straight down.
You sure we should cut the whole thing?
Yeah, you can do that today, but we're not going to skin it all, but you can make the cut.
Okay.
What we are going to do is we're going to cut here to about at least right in here.
For today?
For today.
Okay.
And then right along the mandibles, right along there and there, and then one side or the other, you're going to continue that right behind the eye, straight up over the head, and take the neck all the way back to here, and then connect the two, because what we need to do is skin this whole area here, this area here, and this area here. Those are the muscles we're looking for today. Okay? So here are the external jugulars. You can see they're injected with the blue dye. And then down in here, we should be able to find, see the pink? That's the carotid artery. So everything in pink is going to be an artery. And here's the internal jugular that's in blue. One of the other things you need to find is a white structure in here called the vagus nerve. So you think red, white, and blue. The red is the carotid artery, the blue is the internal jugular, and the white is the vagus nerve. It's one of the cranial nerves. It comes all the way down into the thoracic cavity. So take your blade, cut from the symphysis of the mandible straight down, and then cut right along the commissure of the mouth, along there, come up. The eye is right in here, cut behind the eye to the middle of the forehead, extend this cut to the midline, and then connect the two, and then start very gently trying to get the skin off. The skin is hardest to get off the head. It's harder than anywhere else, so after today it gets a lot easier. But we kind of have to start with the head. So as far as like how much pressure, you don't need to worry about cutting anything because it's not going to hurt the cat, and everything, even if you cut it, it's still there. So you don't need to worry about that. You would start there, just gently go like that, and then take a pair of tissue forceps and grab an edge. You might need to, let me just show you how thick the skin is. There. That's the skin right there. Okay? And what you see under there is fat. So, and then this kind of cobwebby stuff down here, this is fascia. And if you just lay the blade on it, it will come right off like that. Yeah, it is. Actually, skinny deer is easier.
Oh, heck yeah.
Much easier.
It's bigger.
It comes off easier.
Especially when it's hot.
Is that because of the twitch muscles?
This is because it's not fresh. A freshly dead animal is much easier
You
to...
get something nice and hot, you can just pull it off.
Actually, you can do that with this too. You can actually just get your fingers in and...
Just peel it in.
Yeah. But you can just lay the blade like that and it'll start coming. Now what you're seeing underneath here, this is the muscle, the pink stuff. And muscle, you can always tell muscle because you can see the fibers. See how there's fibers running this way and then this way. So begin to start saying, all right, I know what this tissue is, I know what this one is. But that's what you're going to do initially, is just try to get the skin off around in here. Okay?
Okay.
All right. And if you want to look at the muscles, you can always look at the demo cat and see them on there pretty clearly.
Okay.
Okay.